Also breaking this morning, House Speaker Paul Ryan defending the Republican health care plan after the Congressional Budget Office said 14 million more Americans would be uninsured next year and 24 million by the year 2026 because they will be freed from the government mandate and able to choose their own health plan.
Look at what they said, the reason why they think this uninsured would happen. We're saying the government's not going to force people to buy something they don't want to buy. And if we end an Obamacare mandate that says you must buy this government one-size-fits-all plan, guess what? People aren't going to buy that. So, of course, they're going to suggest that if we're not going to make people do something they don't want to do, they're not going to do it. That's really what's behind this.
This comes as Democrats slam the Republican proposal to repeal and replace Obamacare.
How can they look their constituents in the eye when they say to them, 24 million of you are no longer going to have coverage? And those of you who do have it will have less in terms of coverage at more cost to you.
And Peter Barnes is at the White House with more on the CBO analysis. Peter.
Well, the CBO says that 14 million people would lose their health insurance coverage in 2018 under the House Republican plan to repeal and replace Obamacare, mainly because of the repeal of the government mandate on individuals to buy health insurance coverage. CBO says that number would rise to 24 million by 2026 as the federal government repeals the Obamacare expansion of Medicaid. The bill would basically turn the program into block grants for the states. CBO said the House Republican plan would reduce federal deficits by about $340 billion over 10 years as government Medicaid spending declines and federal subsidies to help people purchase coverage are repealed. But Republicans will replace some of those subsidies with tax credits. The CBO accounting is sure to give opponents and supporters of the legislation ammunition. Before its release, the president said he would keep wheeling and dealing on it.
The House plan will expand choice, lower costs, and ensure health care access for all. We're negotiating with everybody. It's a big, fat, beautiful negotiation. And hopefully we'll come up with something that's going to be really terrific.
CBO did not include an analysis of the impact on the economy of the House Republican plan, saying that its deadlines for this report were too short. Back to you in New York.
All right. Thank you, Peter Barnes.